Welcome into the Sunday Journal. I'm your host, Matt Pittett. Thanks for being with us today. We get together each week to talk about issues facing Cape Cod, the islands, and all of southeastern Massachusetts. Welcome in. Always glad to have you with us here today. One of the most pressing issues to face the Cape and Islands in decades really is the heroin and opiate epidemic that has swept across our shores, but it is a crisis that is impacting communities around the country. There is really not one community in our nation in the last couple of years that has not been impacted by this scourge that has taken so many lives and caused chaos for so many families. Today on the Sunday Journal, we're going to have what we hope is an in-depth and a thoughtful discussion about what Cape Cod is doing right now when it comes to education and prevention. We're going to have a discussion about where we are, with how this is impacting some portions of our community, and what's being done in terms of trying to get people either off of the heroin, off of the opiates, and educate them about the dangers of this. We brought in a really great panel to talk about it today. First of all, Beth Albert is the director of the Barnstable County Human Services Department. And Beth, thanks so much for stopping by and being part of our panel today. Appreciate it very much.
Hi, Matt. Thank you.
Terry Ahern is the senior vice president of strategy and government affairs with Cape Cod Healthcare, which of course runs our healthcare system here on Cape Cod and is also the largest employer here on the Cape. And that has an impact as well when it comes to employment issues. And Terry, thanks so much for stopping by today. Appreciate it very much.
Thank you very much, Matt. We're happy to be here.
Sure thing. And the CEO of the Cape Cod Chamber of Commerce, Wendy Northcross. They deal with many issues, and many of them of the social nature, and this one is one that has definitely been impacting the Cape in various ways, and Wendy's going to talk about that as well. Wendy, it's always good to see you. Thanks for being here today.
Good morning, Matt.
Thanks so much for stopping by. A bit of the backdrop for this issue, we've been talking about it a lot in the news, reading about it, hearing about it. Not just our organization, but even off-Cape organizations, off-Cape media outlets have been reporting how this heroin epidemic has just exploded around the country. We hear about it every day. It's a situation where it's not, is there an arrest or is there an overdose from heroin, unfortunately, but how many were there in communities across our country? Now, one thing that came up recently is this HBO documentary. It's a bit of a backdrop for our conversation here today that aired publicly for the first time this week. They're talking about, the title of it was Heroin, Cape Cod, USA, I think if I have that correct. And there was some initial concern, I think, about what this documentary was going to present and how was it going to portray Cape Cod. But I think, my thoughts on this, is my opinion on this one, is that as I watched it actually in its entirety this week, is that it really doesn't it doesn't make a statement about Cape Cod. It's really making a statement about what the heroin issue and the opiate issue is doing to young people, not just young people, but of all ages around the country at this point. And there was a forum that was held, we'll talk about that as well, about a week and a half ago or so, that showed Cape Cod as this film before it actually aired on HBO. A couple of statistics that came out of this, and Beth, I'm going to start with you to kind of help you frame the issue of where we are in 2015. I printed out, you remember this very large report that you folks released from earlier this year, analysis of substance abuse on Cape Cod, a baseline assessment. Some of the statistics that came out from the HBO documentary, that 80% of heroin users started with opioids. Almost all start smoking with pot in some way. They talked about whether or not Narcan is really a solution. And one thing I saw that was really telling in the documentary was that there was one woman that said that she knew she was near a hospital, and she shot back up right in the hospital parking lot because she knew there was Narcan nearby if necessary. And we'll talk about that as we go on. So Beth, I'd like you to frame the issue for us. Kind of where are we right now, late 2015, early 2016, as people are listening to us this weekend with the issue on Cape Cod?
Sure, thank you. So back starting in 2014, the county undertook a comprehensive scan of substance use on Cape Cod, not just looking at opiates, but looking at substance abuse, including alcohol and marijuana. And one of the big takeaways from that baseline assessment that you referenced was that, in many respects, Cape Cod was not unique. Our rates and demographics regarding substance use were similar to what we were seeing across the state. But because of that work, because there was so much going on in Cape Cod, we did pull together a regional substance abuse council. We have participation from about 40 different groups, including the Chamber, including Cape Cod Healthcare. And we did come up with an action plan that we're implementing right now, and hopefully, we'll talk about that a little bit later. But as far as, the statistics that came out of that baseline assessment, just to give people a sense of the human and financial costs of substance use in Cape Cod, in Barnstable County, about 14% of Cape residents live with some type of chronic substance use disorder. About 8% of Cape residents are addicted to alcohol. And we know this, that we're in the midst of an epidemic because overdose rates have more than doubled since 2012. Right before I came this morning, I did. We get some information from the DA on a regular basis as far as unattended overdose deaths in Barnstable County, and as of November 30th, there were 39 unattended deaths. Compared to 2014, we got some information from our Department of Public Health. In 2014, there were 51 overdose deaths in Barnstable County only. So it appears from looking at what we're getting from the DA now, it appears we're about on the same pace for overdose deaths on Cape Cod, on Barnstable County for 2015. Unfortunately, the data, the lag time from our Department of Public Health is about 6 to 9 months, so we won't know actually what that data says until sometime later in 2016, but it appears we're about on the same pace for overdose deaths in 2015 as we were in 2014.
Before we started our taping today, I was conducting an interview with Captain Brian Reed over at the Falmouth Police Department to preview a couple of forums that are going to be coming up in Falmouth in January and February. They were talking about how their numbers are just through the roof when it comes to this issue, and it's really just a scourge on their streets again. And the forums that they're going to hold are kind of trying to look for answers and solutions as to how to help people,
Sure.
prevention, et cetera. So what do you think should be the message at this point? I mean, there's so many aspects to this story, but we want to kind of talk today at length about what's being done to try to get at the heart of this. And, I think we have to talk about what we're doing to help people who are already addicted. Mm-hmm. We have to talk about what we're doing before people get addicted. And then this may even be a segment for a third segment down the road. But in terms of law enforcement, none of the four of us here can talk about law enforcement issues. But what is law enforcement doing and what should be done at this point? So from the county level,
Yep.
What's being done right now?
So
Beth?
when we, in our plan and in the work that we've done, we looked at what's going on in prevention and what more needs to be done. We looked at what's going on Cape Cod around harms reduction or intervention and what more needs to be done. The same for treatment. And something in the past we didn't talk about a lot, which is recovery, and really the need to create a very, very supportive recovery community on Cape Cod. So the work that we're doing through the Regional Substance Abuse Council is looking at all of those buckets, what's happening, what we can do better, and what more needs to be done, being very mindful of what's happening at the state level and at the federal level as well. And so using that kind of public health lens to organize ourselves, to create communication structures, because I think that's really important that we continue to communicate what each other is doing and where there's opportunities to work together more closely and to support each other's work, because there is a tremendous amount going on and there's a tremendous amount more that needs to be done. So we're looking at all four of those particular segments.
All right, let's bring in Terry Ahern to the conversation with Cape Cod Healthcare, Senior Vice President, Strategy and Governmental Affairs. Terry, I know that earlier in the year you folks brought on Cheryl Bartlett, former State Health Commissioner, and registered. She's a medical professional herself, a nurse. So let's start out just from Cape Cod Healthcare standpoint. What's the strategy right now and how you folks are attacking this issue? We've seen the movie. We know what's going on in the streets every day on the Cape and the state and around the country. So what's going on from the standpoint of the healthcare institution?
Sure, Matt. I'd be happy to discuss that with you. As Beth mentioned, we had been seeing in our public health data through our work that there was a problem. It was very well known to everyone in the community, but we certainly had it documented both through public health data, what we saw in our emergency rooms, what we see in our inpatient units, where we're having lots of patients on the inpatient side dealing with behavioral health and or substance abuse issues. So we are a participant in the regional council. We have not only Cheryl participating, but a great number of staff kind of across our organization, both from our community benefits aspects, from our leadership team, from our clinical areas as well. And we participated in the study, and one of the things that was very enlightening to us was for the dollars that are spent on this problem, very little of that money is spent on education and prevention. So the bulk of the money is really focused more towards intervention and treatment, even though that's not sufficient at this time. So what some of the things that we've been looking at education and prevention, particularly around youth, and working with our physician community on the prescribing side. And we're also looking at what we think is a very fundamental aspect of this, which is the mental health component. So we tend to broaden it immediately back from not just substance abuse, but the whole behavioral health issue. As Beth said, we understand the substance use epidemic is not unusual to the Cape. It's a national and statewide issue, but the burgeoning mental health issues are also of great concern for us. So our strategy really as a healthcare system is to work with the community. I mean, individuals dealing with either substance use or mental health don't just deal with it within the four walls of the hospital. They're dealing with it every day in their lives and out in the community. So we're attempting to partner with the council, our legislators, local government, the chambers, business community, law enforcement, court, schools, everyone, religious leaders, parents, citizens, everyone that participates on the council. And also, very importantly, other providers. So Gosnell of Cape Cod and the 4 federally qualified health centers. Very important, I think, to trying to address this both from an education and prevention and from a clinical basis. We also were very lucky to put together a coalition with the Kelly Foundation and the Davenport Family Foundation, both of those foundations seeing a lot of grant requests coming to them and wanting to coordinate instead of everybody giving money without having a systemic kind of approach. So really what the strategy was to participate in and see the data and see where some of the needs were, and the county did release that report. We've been doing, even prior to kind of this push, the hospital and Cape Cod Healthcare, both Falmouth and Cape Cod Hospital, working through our various community benefits programs, support a lot of community work, and we can't say enough that this is something that community partners have a very big role. So in some aspects, we're adding strength in our organization in making internal investments, but we're also doing funding with a lot of community groups to try to get at this. We've done a lot over the past year to expand our mental health capabilities. We've recruited 4 new psychiatrists and advanced practice nurses, and what we're really trying to do is connect the emergency room, where a lot of substance use patients and behavioral health patients end up, with our behavioral health staff, with our inpatient staff, and our outpatient staff. So there's a whole continuum of care before folks come into the healthcare system and then after they leave the healthcare system. So, we do think that this is a community issue. It's a complex issue. It's going to take some time, but the foundational pieces are being put together to try to offer essentially more access and more education so people know where to go. It's not just the folks themselves, but it's also their families. This is a challenging situation for family members as well. So, but as I said, it's really been a broad base of support across the Cape, which I think is probably the light in this picture, which can be sometimes very discouraging, I think.
There's a real cost to this. I'm looking at some of the numbers from the report here that Beth was referring to and that I referred to previously. And for the listeners, if you haven't read this, I know it sounds like, geez, Matt, you want me to read this 94-page report? But, yeah, you know what? I'm asking you. I don't ask my listeners to do much. I just want them to listen. But I would ask you to take a look at this 94-page report. It is available on the county website, and it really lays out what the issue is here. So, according to the report, the summary of substance abuse-related criminal justice system costs as of 1/1/2015 was $54 million, $732,818. And then I'm looking at another table here, the estimate of substance abuse treatment and recovery cost, inpatient and outpatient, involving places like Cape Cod Healthcare and Gosnell, was $49,665,073. There's a real severe economic impact on this. Wendy Northcross from the Cape Cod Chamber of Commerce. Wendy, from that aspect, this has become a real big issue. Your businesses recently, within the last, year, couple of years or so, reached out to you and said, we could use some assistance because we have employees that are coming in high, not coming in, and it's become a real economic impact as well, not just a healthcare issue as well.
Oh, definitely. And I think that's, it's important that we have Barnstable County's leadership. It's important that we have the business community's leadership on this issue, because it is going to take our entire community working together on this intractable problem. My employers who sit at the board table were telling me stories that would curl your hair. And part of it was, the concern of crime. We have bank robberies that are fueled by mental health behaviors gone awry. We have, employers that are desperate for employees and find this constant door or churn in employees not because the person isn't skilled, but because they have an abuse problem that then knocks them. They just stop showing up for work. So they were finding that on a day-to-day basis, substance abuse, while it might not have been in their home family, it was definitely in their work family, and they were looking for some leadership and some help on the issue. So we actually a year ago formed an opiate abuse task force. Judy Scarafile, who is on our board of directors, she's a pharmacist by training and trade. She has been our liaison to the county's initiative, and we're here trying to be the voice of support and understanding and trying to learn more, quite honestly, because it is complex and it does have varying degrees of solutions. We're very solution-oriented, but this is not an easy fix, and depending on who and what, it's near-term and it's long-term.
Now, you mentioned the crime issue. One statistic that came out of the HBO documentary, and I think I wrote it down correctly, was that police estimate that on the Cape, 80% of all crime that's happening right now has some connection with what's going on in this drug issue. So that has an economic impact on businesses and on our residents, obviously.
Absolutely.
As you said, I know I've heard from some of your members as well, but what businesses are saying, and I've heard stories of employers where people come into work and they're already high, or they may try to shoot up while they're at work and they're dealing with customers, and that's just things. This does not go well. So, what is the chamber going to try to do? I know you have this task force that you're working with, but realistically, what can the chamber do when it comes to these issues? What are you trying to do for your members?
Well, some of the things that we've already done. Have offered workshops with experts coming to speak to employers about the signs of substance abuse, how to identify it, and what steps they can take in the workforce. What are their rights within the workplace to help that particular person. We're looking at everything from supporting our, police and first responding community with the tools that they need to get the job done, to advocating for legislation that will help put resources into our community for prevention. I mean, the statistic I have is that in 2013, over $110 million was spent on prevention and intervention and treatment, but just 1% of that was on prevention and education. So I think we need to get into our school systems, and we need to get into these non-traditional places to educate people on what's happening in our community and give them some tools to be able to address what's happening. So I think that what we're looking to do is continue to advocate for our health providers and our first responders, but then also to really help with that education at all levels.
We're going to take a quick break. We're going to come back and continue to look for some answers here on what is a very complex problem here on the Sunday Journal as we discuss this issue of heroin and opiate abuse on the Cape with our panelists. We're back in just a moment here on the Sunday Journal.